Welcome to this edition of Mon Health Talk.
Good morning. Welcome into the program, Mon Health Talk. I'm Dave Wilson. We've got a big show today. 3 guests on the line. Well, 2 on the line, 1 in studio this morning. So let's get to it. Joining me in studio, President and CEO of Mon Health System, David Goldberg. Dave, nice to see you again, buddy.
Good morning, sir. Good to see you live.
And, I'm just happy to have a guest in the studio every once in a while. It gets kind of lonely in here every once.
I'll come see you anytime.
I appreciate it. And on the phone today, we have the President and COO of the health plan, Jeff Knight. Good morning, Jeff.
Good morning.
And also on the line today, we have the Executive Vice President and CFO of Charleston Area Medical Center, Jeff Sandine. Good morning, Jeff.
Good morning.
All right. We've got a full house here on the program, as you might guess. We're talking Mon Health and the health plan. David, we know you, so you get a pass in this segment for just a moment. But let's get to know our guest just a little bit more. Jeff, I got 2 Jeffs. Jeff Knight with the health plan. Give us a little bit about your background, buddy.
So, been the president and COO at the health plan for 2 years. I've been working for the health plan for almost 25 years. Worked through the finance department at the health plan. It's a great organization. A little bit about the health plan. We're a nonprofit managed care organization. We provide health care benefits to members throughout the state of West Virginia and Ohio. Primarily, it's Medicare, Medicaid, PEIA in West Virginia. We cover about 150,000 lives in West Virginia. Very excited to be talking about the High Performance Network here today with Mr. Goldberg and Mr. Sandine.
All right, Jeff Sandine, give me a little bit on your background.
Yeah, good morning. So I've been at Charleston Area Medical Center for 5 years as the CFO. Been in healthcare for many, many years, kind of like Jeff Knight. Most recently came from Sioux Falls, South Dakota. But I am very excited as well to be a part of the High Performing Network, and CAMC and Mon Health complement each other very well. And I think the great partnership that we've had with the health plan for many years as well is just another benefit to the High Performing Network that we'll be talking more about today. So good to hear from everybody.
All right, Jeff Knight, can you explain, you've mentioned it, and the other Jeff mentioned it as well, what is the High Performing Network? What's going on?
So what it is, when we provide benefits, sell benefits to employer groups throughout the state, the one thing that we always hear about is, how can we control healthcare costs? And talking about the High Performance Network, we've partnered up with Mon Health and CAMC to put together a plan that will allow employers to go to great quality facilities. And if services aren't provided at those facilities, they can still use the entire health plan network that we provide to all of our members today.
So, David, what's the importance of Mon Health, CMAC, and the health plan all partnering here with this statewide approach?
So I think you hear me say quite often, we are blessed to have excellent health care here in West Virginia. What this plan does is it brings CAMC, Mon Health together as Tier 1, if you will, to be able to help lower cost, provide broader access to different beneficiaries or people with the health plan insurance to be able to use our facilities, reduce cost, and have access to high-quality care that us West Virginians need and require and expect. And we're thrilled to partner with a health plan like Jeff Sandine said. We have a long history of accepting patients with health plan insurance, and we think this is an opportunity. I said on Friday when we met with a smaller group, Jeff Sandine and I are the same as any employer. We have thousands of employees. We provide health insurance, and we look at the cost and the outcomes every day, every year, every month. And we are them. So our opportunity is how do we reduce our cost and improve better access, better outcomes to the people we insure? And this is something we can roll out broadly across West Virginia.
All right, we're going to get into more about the network benefits, what the plan offers, how this impacts folks here in our area. But first, we do have to squeeze in a break. 3 guests on the show this morning: David Goldberg, President and CEO of Mon Health; Jeff Knight, President, COO of the Health Plan; and Jeff Sandine, Executive Vice President and CFO of Charleston Area Medical Center. And this is Mon Health Talk. We're back in a moment on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Our guest in studio this morning, David Goldberg, President and CEO of Mon Health System, Jeff Knight, President and COO of the Health Plan, and Jeff Sandeen, Executive Vice President and CFO of CAMC. Gentlemen, welcome back. And I'll throw this one to you, Jeff Knight. What are some of the benefits this plan will offer?
So the nice thing is that the plan will include all the benefits that the health plan provides today. The plan is really designed at this point for large employer groups that have a benefit plan of their choosing, basically. So they can select their own member deductibles, coinsurance, out-of-pocket maximums. We will work with each employer to make sure that we have the right benefits in place for their members. And I think that's what's good about this partnership as well. We will also work with Mon Health and CAMC to make sure that it fits the needs for each employer. So I think that's why it's a great plan. You get all the benefits that you have from the health plan today, plus the high-quality care from both Mon Health and CAMC.
And we'll go to Jeff Sandeen. What's the benefit for this partnership with Mon Health? How does CAMC factor in on all this, and how does it benefit the end user here?
Well, I think Jeff Knight said it well. I think from an employer perspective, and we're all trying to look at our overall cost, and so this is a great option. And so the partnership that we've had with Mon Health over the years, this just solidifies our network of care that we have across the state. Our primary care network, our specialty network that we both have in place, is a great benefit to employers in our region. And so I think giving employers the option to have a lower cost option with the benefit of having the wide network availability, I think is key. And I think that's why when we've talked to several brokers about how is this going to be perceived in the marketplace, and they're very excited about from a large employer perspective, that this will be something that they've been looking for. And I think the relationship that we've had in the network that we have, and if you look across the state from the coverage that what Mon Health has and what CAMC has, I think will provide a very solid Tier 1 network that folks will be able to access and lower their healthcare costs.
And David, what's the impact here for employers in the Morgantown, Montegue County area?
I think Jeff Sandeen said it well. It gives broader access. So our goal is to keep as many of people from West Virginia in West Virginia for top quality care. We get that already with all the providers across the state. Many people ask me, and I know they'll ask Jeff Sandeen, so what do you offer that another one doesn't? We pretty much offer the gamut of healthcare services. We all have top cardiac programs, cancer programs, surgical programs, primary care programs. What we don't do at Mon is transplant. A great place like CAMC, WVU Medicine, and others, they offer it, so we don't have to recreate the wheel and partner with these great organizations to do it. This plan will give access to those level services in the geography the business is located, where the remote workers are, to get access to care, low cost, very high-quality providers. CAMC is a former Malcolm Baldrige winner. We have 2 Leapfrog A hospitals at Stonewall Jackson Memorial and Mon Health Medical Center. So we lead with our outcomes and our service outcomes, and now we're opening it up even more broadly for people to use us.
David, was it difficult to work out this partnership? In some ways, you're competitors, but we're talking about the same goal, provide the best health care possible to as many West Virginians as possible. So you don't have to go to Cleveland or Columbus or Baltimore. You can stay in state. So was it difficult to work this all out?
I have to say, out of the more than 2 decades in healthcare I've been in, this has been the easiest thing to accomplish with great people led by Jeff Knight and Jeff Sandeen and his team and us. This goes to show you don't have to own everything and be everything to all people. You can partner and collaborate to bring the best of the best to people across us. We now are bringing 2 independent health systems that are highly regarded in a way to collaborate to provide access, reduce cost, and make it even better for businesses. Like I said in the first segment, we are those businesses. At Mon, we have nearly 3,800 employees, so I look at my healthcare cost and outcomes. If we could take that same expertise that we're doing ourselves and bring it to employers, that's more money in the pocket for employers to give back to their employees.
Jeff Sandeen, I'll kind of toss the same question to you. In some ways, you're competitors, but in this case, putting a partnership together, David said it was a pretty easy partnership. Putting words in your mouth there a little bit, David, but he said it was pretty easy. What were your thoughts?
Yeah, I would agree. I mean, we do have a great relationship, and David said it well that we don't have to own everything across the state. We look for partnerships, and this was a really easy partnership for us to form. We have other partnerships that we have as it relates to healthcare business, and at the end of the day, you have employers that are in Morgantown, you have employers that are in Charleston. From like a satellite office, and so actually it fits very well when you look at the state geography of where a lot of employers have their primary offices, but they'll have maybe even folks working in Charleston virtually in our new virtual world, and so they'll have access to healthcare through their Tier 1 being in the Charleston market as well. So it was we will continue to develop partnerships with Mon Health and see this as just another step forward of what we've been doing for many years already.
All right, going to squeeze in another break. Our guest this morning, Dave Goldberg, President and CEO of Mon Health System, Jeff Knight, President, COO of the Health Plan, Jeff Sandine, Executive Vice President and CFO of Charleston Area Medical Center. I'm just Dave Wilson hanging out. Mon Health Talk continues in a moment.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
Full house today. David Goldberg in studio with me. Jeff Knight, President, CEO of the Health Plan, and Jeff Sandine, Executive Vice President, CFO of CAMC, on the line this morning. Jeff Knight, when does this plan go into effect for the employers in the state?
So the great thing is that this is available right now for all self-insured employers. So if you're looking for your benefit plan for 1/1 of 2022, I would suggest you reach out to your broker or one of our sales agents here at the Health Plan. For fully insured business, this will be effective for 2023. We have to file with the Department of Insurance, so it's going to take a little bit more time. But for self-insured employers, you're eligible right now.
And Jeff Sandine, if I'm an employer, I've been listening this morning, and I find all of this intriguing. Why is this a partnership in the health plan something I should consider?
Well, and I think when they look at the renewal, and I think when folks think of their employees and where they're accessing care today, and if they're in the like Morgantown market or even with the satellite in the Charleston market, I think that they would know that if they're accessing our systems for care, this is a great way for them to look at reducing overall costs for this next year. And I think all the employers with technology that's rising in inflation costs with drugs, everyone's looking for ways. And so this is a great product that they should be looking at for the renewals for this coming year.
And David, I'll start with you, and I'm actually going to toss this same question to all three of you. What are the next steps in this partnership?
I think get on the phone and call the health plan and say, yes, I'm opting in. One of the great things, while CAMC and Mon Health are two independent organizations, we have the same electronic health record. We're both on the Cerner system. With approval from the patient, we can actually share from a specialist we may not have at Mon Health to a specialist at CAMC or vice versa, that data. So it reduces costs, reduces variability, and really improves continuity of care. Secondly, we hope to reduce cost. Hospitals, doctors are penalized from Centers of Medicare and Medicaid, payers, for not optimizing or having the best outcome. We need to get our people in across West Virginia to own their health care, meaning own your health care, own your outcomes, own your sickness and your wellness so we can help you stay healthy and continue to move forward. And thirdly, to the employers, like I said, you are we are you. It helps us reduce costs overall to get that back into the pocket to expand your business and get it back in the pockets of your workers.
Jeff Sandine, what's the next step in this partnership?
Well, I think from an employer perspective, contacting the health plan is the key next step. And David Goldberg and I will continue to kind of talk to employers as they have questions in our own markets, trying to educate them on the value of this high-performing network. And I see, just the expanding of services and probably an area too, just as we think of specialists, telemedicine, how we link between regions is also a key for folks getting access of care at a lower cost. And so it's very exciting for this kind of new calendar year coming up for 2022.
Jeff Knight, you've had plenty of time to think about your answer to the same question. Now, what's the next steps, bud?
So I think this is going to continue to evolve. We'll continue to look at other providers who provide high-quality care that would be a good complement to this solution. We'll also continue to look at other initiatives with technology to help control costs that would also be beneficial to employers and members, and also this product that we're rolling out.
And David, it seems to me, and this is kind of an observation, this is kind of a common sense partnership with so many employers who, and I can probably think of a half dozen just off the top of my head, who have branches in Morgantown and Charleston. It just seems like such a common sense approach here.
And I would argue in between. I mean, Mon Health goes as far south as Elkins. We have a clinical collaboration with Minnie Hamilton, and we manage Grafton City Hospital. They're part of this as well. So all the people in those geographies, let alone the great care that CAMC offers in their geographies of care. And then you have other providers that are not what we call the tier one like us two, that have access to this too. So everyone has access through this plan. It just comes down to what level of financial obligation you'll have, depending on using us as the hub and then other providers working their way out.
Jeff Knight, where can people learn more about the health plan?
You can go to our website, healthplan.org, and look up information. You can also contact any of our sales representatives. That information is on the website as well. And the other area you should go to is if you're an employer listening to this program, you should talk to your broker and have them reach out to us, and we'll work with them to get you a rate.
And before I let all three of you go here, we got about 2 minutes. David, just generally speaking, how are things at Mon Health at this point? Just kind of checking in.
We're doing extremely well. COVID numbers have come down a little bit. I was telling you at the break, it's the two Daves in one room and the two Jeffs on the telephone. We've come down about 60% in our COVID population across Mon Health. We went about a week at Grafton City without any COVID patients. We have 2 today. We have 20 at Mon Health Medical Center, 6 or 8 in the ICU. Still seeing a lot of people who are unvaccinated coming in for COVID care, but we're seeing good stewardship and good care. I can't be more proud of our people. I think you might see on social media, we put an ad in the paper of people who have years of service with us. I couldn't be more proud to be a Mon Health colleague. Our people are second to none.
Hey, Jeff Sandine, how are things down at CMAC?
The number, just like Mon Health, the numbers are improving. We have 70 inpatients today. That's coming down from close to 100 that we've been running. So it's improving, but again, folks getting their vaccines is key for that success to continue. And I too just can't say enough about the clinical team that's been able to take care of the COVID patients, and all the sacrifices that they've made over this last year plus has been tremendous.
Well, guys, give our best to all of your staffs, your nurses, everybody, because I know they've been long hours, and it's been stressful for the last year and a half plus. So give our best to all your staffs, guys. Appreciate it.
Thank you.
Thank you.
All right, our guest this morning, Jeff Knight with the Health Plan, Jeff Sandine, Charleston Area Medical Center, and Dave Goldberg, President and CEO of Mon Health System. Guys, appreciate it very much. Thanks for stopping by.
Thank you.
Thank you.
Thank you.